gorgeous. Good morning, all you gorgeous mothers out there. I could not let the day pass without getting on and saying Happy Mother's Day. Hello, hello. Hello, gorgeous, beautiful mothers out there. Good morning. Good morning to you all. Good morning, gorgeous. We celebrate you and all that you do. If nobody appreciates you today, I do. Happy Mother's Day to all of you, girl, because we know. Listen, and don't let no Mickey Ficky start no argument with you today, girl. Trying to ruin your day because they need to celebrate you. You know how they do. They want to start a little nitpicky stuff because they ain't coming or showing up right. Happy Mother's Day, Miss Tammy. And my blessed sisters. Yes, our blessed sisters. Today is... What are you doing today, Miss Tammy? Well, let me tell you what Miss Tammy doing today. I am doing somewhat of a rescue. I said I was going to be at the rescue game. So, we have a young lady who came with a friend who's having a mommy makeover and is staying in a hotel. Okay, and I'm going to leave that right there. So, on Mother's Day, I am going to better prepare this young lady for her journey. I got a call from a friend who says, she done lost her damn mind. Miss Tammy, she down there getting ready to have surgery, which is going to be a mommy makeover. She's actually having the surgery on Monday. She brought a friend with her. They did a lot of reading and research and, all of that. And, but, nobody's really skilled. Nobody, is really, I think that you can superficially prepare, get all your supplies, but supplies ain't gonna do shit for you when you on the ground or can't get to them or no. So what I'm going to do is I'm going to make sure that we're going to do her hemo, we're going to do her blood pressure, we're going to make sure that we find things that stabilizes her, let us find out where she's at prior to surgery. We're going to offer 8 hours of service for her tomorrow after surgery, making sure that, her prescriptions and everything is in, making sure that she has medication prior to surgery. Again, making sure that we are checking her vitals. She's having an ETT with breast aug. And that is something that definitely means for the first 24 hours she definitely is going to need assistance. We're actually going to go in and train her her support system on what to do to further assist her once we are gone. We're going to give that educational piece, making sure the right nutrients and the right types of food is there. Okay, so again, it's a rescue, but sort of speak, not a rescue. So we don't have to rescue. It is helping her make sure that she is properly prepared, making sure that things are there in place as far as emergency situations, explaining the neurological delay that can happen in case she is fainting, what to do, all of that. Unfortunately, I will not be able to do 24 hours, but we're going to give her as much support as we can. I'll have someone there right after surgery for about 8 hours, and that should be good enough to get her pain managed, get her rested, telling them what to do to get her to the other side. So again, that's what I'm doing on Mother's Day. I'm out helping somebody on a day, and that's what we are. We're nurturing spirits. We're caregivers. We're all of the above. So speaking of that, there has been in people these are the things that people aren't saying. There has been a lot of reported deaths that are happening in the state, at the state level, where it's being reported to the state. And you guys may not get wind of a lot of it, but the Airbnbs now are really being scrutinized because they are being held responsible for deaths and near-death experiences that are happening within their home. So you guys are going to watch out for Airbnbs pushing back, maybe liability clauses being signed, saying that the owner is not liable for whatever happens. We do know a lot of the hotels are, so it's a catch-22, right? Lots of people aren't trusting recovery houses, so it's like, fuck that, I'm gonna get me a hotel, I'm gonna get me an Airbnb, and I'm gonna get Pookie and Ray to come down and help me. And what I want to do is let you guys understand that the ramifications, even if in fact there is something traumatic or life-threatening happens, and this person took responsibility to care for you, even in the family, as a family member, the state of Florida, they can be liable if something happens to you. That's one of the reasons why a lot of recovery houses are getting fined, because people not being trained for that situation and that they put themselves in. So a lot of people don't understand that you could possibly be putting your family member at a legal situation where they can be legally prosecuted if something happens to you. With the factors in place, knowing that you had surgery, they picked you up, they took responsibility for you. Okay, send me your number. They took responsibility for you. Just being me, 89. Yeah, inbox me your number, because I might have it, but I don't really know, Instagram names like that. So you might already have it, but just inbox me. This is me. Give me a call, Miss Tammy. I just really want you guys to be aware that these things are something that you have to consider when you are doing this. Sometimes we think that there's always a shortcuts kill. There's always a different level, and that is why, if you guys have seen one of the posts, and I think I need to post another post where they're actually saying that they are also coming up with other things to charge with, and they are now going to charge people, because it's in the state of Florida, that you would come here and you would take responsibility for a patient that had surgery in the state of Florida, and to take housing in the state of Florida with a patient. It's almost like endangering the welfare. That is a charge that people didn't know that has happened to a family member who kept someone in an Airbnb, and she ended up on life support. But people aren't talking about that, so we're gonna pull a lot of that out. You guys have to really look at all of the angles of this stuff. And I know it's so hard. What do I do? Who do I trust? Where do I go? I just want, to be around my family. Find a recovery house that supports you and your family, or supports having a family member with you. But you guys are actually going to start to put even your family members and close friends in a legal risk if something happens to you and they are not certified nurse, or they're not a certified medical professional that will be keeping you in these hotels and stuff. And the hotels have the right in Airbnbs to press charges against you if in fact you put that location, or what you call that residence, or that establishment. Oh Lord, oh my God, I am driving. I got coffee all over the place. Where do they expect people to go? This is just another tactic of them to try to monopolize and control. Yeah, where do people go? Where do people want to go? This is the things that I'm not sure of. What did she say? Clarion? Did she have the Clarion? Okay, of what they want you to do, but evidently there's going to be something down the pipe that says that they are going to either, again, as you know, they are trying to mandate recovery houses to run as ALFs, which means that the state regulated and mandated facilities getting certified as an ALF. All of these tactics are going to be mechanisms to corner you off into, you know, what they got coming down the pipe. We don't know what it is, but when it starts off like this, again, you know, me looking into, you know, the ALFs and ALF facilitator certification, being certified is not just always enough. They want you to run, but again, long as you are showing the intent that you have, especially the recovery houses out there, that you are ALF certified official, you know, for one, you need that certification. For two, you need to make sure that you have certified staff, because, you know, it doesn't mean that you intend to place anyone at risk or at harm, because you do have certain things in place that say you are certified for the situation, and in case there is an emergency situation, you guys, I am lost. In case there is an emergency situation, you can handle it. Okay, so that's one thing that will be good for houses, to make sure that they are running as, I think if you notice, a lot of the houses, the ones that they have ran in, they basically are saying that they didn't have any nurses, you know, no one was certified, no one had first aid CPR trained, there was just nothing, you know, just cotton and squatting the cot. So you definitely want to look out for that. So the state wants exactly, the state wants some of this damn money that's running around here, and so at any cost, what they do is they begin to apply pressure. Give me a second, I'm trying to figure out where I'm at. They begin to apply pressure on they apply pressure in certain ways, and we know pressure bursts pipes. So what you have to do is you have to, then again, as I told you guys, I give you a list of things to do, right? A list of things to look out for. Good morning, happy Mother's Day. A list of things that you guys, yes, when in fact you think you got it figured out, there's a roadblock. But what you have to do is know what the game is, know who the players in the game is, okay? Making sure, you guys, that when you are signing, because what happens is if we are taking shortcuts, that we are being honest with these Airbnbs. This is, you know, this is this. And a lot of you guys aren't being honest, and that's why they're able to press charges and say, my name is Westside, and this person didn't tell me that this is what they were doing. You know, that's the same thing with a lot of recovery houses. The owners don't know that they're actually running recovery houses in their establishment, okay? And so one of the things is getting a full scope of actually what, give me a second, of what they expect, what's expected of you, if in fact you need to put down a certain deposit, you know, because you're having surgery, making sure you guys not only bring, you know, your bring your own sheets, bring your own towels, you know, so, because I'm telling you, you know, they have to now retrain, you know, making sure that all their staff is bloodborne pathogens trained. There's a lot of different things, you know, that they're taking all the linen that you're using out in red bags, and so there's a lot of different things that these hotels and stuff are now required. You know, making sure that you have all this, that you make the establishment feel comfortable, that at no chance would they be liable for you, okay? For number one, that's number one you want to do. You also want to check out, just in case, you want to find the nearest, if there's a nearest facility there. What's the nearest hospital? I remember being in a hotel situation, and they had a damn fire alarm, right? And I was on the 9th floor. I actually told them the fire people need to come up and get my patients. But at that point, the hotel knew I had patients, and I'm not gonna. That's their right. And then also, if there's a medical emergency, you can call them to come. It's like a damn cat getting caught in a tree. I have somebody who the elevators wasn't working during the fire alarm. They wanted to take the stairs. I have patients up here. Y'all need to come get them and bring them down if y'all want to do a fire alarm. But the hotel knew, and of course what they did is they were happy about it, but they knew that was their job. They came in and escorted every last one of them patients down the fucking stairs. They carried them. They did whatever the fuck they had to do, because I'm not liable because you guys elevators not working and this and that. So just knowing that if you stay in the know or you stay in the right when you're in these places, you have a honest, open dialogue with the owners, right? Because at the end of the day, they will turn on you. And this is some of the situations with the one lady. They turned on her. They didn't, of course, they don't want to be loud. They want the money for the Airbnbs, but they don't want, if anything happens, they are going to turn on you. Lord and behold, nothing life-threatening happens, but they do, and they do have cameras in there, you guys. They are now putting cameras in. They should. Most of them do. These Airbnbs, they do have cameras, but some of them are putting cameras just to from you alluding what's going on, and making sure that it's in your contract. Because now the Airbnbs are scamming medical patients out of money, because they're saying, okay, this is real. This is real. They are watching them and then saying, oh, you didn't tell me this. Oh, they didn't tell me this, or they didn't tell me that. And now they want to extort you out of extra money because they see that you are a surgical patient. They see you on the camera. Oh, you only said this amount of people was going to be in there. Now I see that there's multiple people in here, and or you got to leave immediately. So you guys really be careful. And I think a lot of this conversation came out because I am actually at a hotel taking care, getting ready to make sure that someone is properly prepared for their surgical procedure here, making sure that all the T's are dotted, the I's are crossed, and letting them know that they do have medical professionals that will be assisting them in their care as well. But anyway, you guys, I am here. So I will follow up on this. Airbnbs, hotels, or recovery houses. What do we do? Who do we choose? What would be the best? What would be financially the best? What would be the best? How do we know we're picking the right stuff? So I think that right now we need to talk about that, because with the scare and with the doctors changing, with us going different places, let's have a conversation. Like you guys know, there has never been a requirement as long as I've been on live for you to book with me, but I just want you to be safe at whatever it is that you choose to do. And most of all, I just want you to have a happy Mother's Day. Be safe, especially those that are headed to Miami with their Mother's Day gift, doing their Mother's Day surgery. You guys understand my Mother's Day promotion will end tonight at midnight. Okay, you guys. And I gotta get off this phone because I ain't the best backer upper. I'm telling you, I would tear up some shit in a minute. Yes, I would. Yes, Miss Tammy. It's a small ass parking lot. It is small. All right, you guys. Until the next time, am I my sister's keeper? Yes, I am. Happy Mother's Day. We'll follow up on Recovery House, Airbnb, or hotel. What do we do? Because the state is making it hard for us to choose anyone. But what do we do? And how do we cover ourselves? And how do we protect ourselves with anyone that we choose? What do we need to look out for? What are the legalities behind it? We're going to get into that discussion on that with more details. I also am going to follow up with being able to possibly go live on YouTube and just continue our journey in knowledge and information. So as always, remember, this isn't for the weak, this isn't for the cheap. This Tammy.